lowering out-of-pocket costs in the near term in the parallel while we're fighting for Medicare for all. And so with the election coming up and of course, issue advocacy and understanding what issues are on the different platforms is really important as healthcare advocates, no matter the outcome of the election. And so this is a slide that really compares the Democratic platform on healthcare to the Republican platform on healthcare. And the Democratic platform can be summed up by focusing on lowering healthcare costs. Now, the presidential candidate and vice presidential candidate in their platform, Medicare for all is not included, but there are a lot of different policies that will lower out-of-pocket costs and can kind of set the stage and get us closer to Medicare for all. And I'll explain that dynamic in a little bit. The Republican platform focuses more on privatization of our current healthcare system. So a lot of things in Project 2025 are meant to privatize public healthcare programs that we do have. For example, privatizing Medicare, dismantling Medicaid, and also deregulating ACA insurance plans. So on the Democratic side, I bolded a few of the policies that will directly lower costs for people, and I wanted to highlight those here. And so one is building on those current out-of-pocket caps that were mentioned in the introduction, and also expanding current Medicare to include dental, vision, and hearing services, because right now, Medicare does not cover those. Some private Medicare plans claim to cover dental, vision, and hearing, but what they really mean is they cover, one dental cleaning a year. If you need a root canal or dentures or things like that, they're often not covered. So, lowering out-of-pocket costs is something that I focus on a lot in my current role at the Center for Health and Democracy. We run a coalition called the Lower Out-of-Pockets Now Coalition. It's a group of more than 70 organizations. We're excited to have your organization in the fight with us. It includes patient groups, but also consumer watchdogs, law firms that help people in cases against their insurers, as well as specialty doctor organizations. And our top policy priorities overlap with those of the Democratic platform, and these will immediately reduce out-of-pocket costs for people. So the first is expanding the $2,000 cap on out-of-pocket prescription costs to everyone. So right now, this is only in Medicare. However, the Democratic Party platform says everyone, and this includes people with private insurance, but it's really, really important to also include people without insurance, because those are the folks who are often most vulnerable to rationing their medication. And when we talk about a Medicare for all system, we mean everyone in, nobody out. So we should not be leaving out the uninsured. And so that is a place where this policy, although it's a small step, can get us closer to that system we imagine where everyone is included in these health provisions. The second policy that we focus on, which is not in the Democratic Party platform, but has some support throughout the Democratic caucus, is lowering the out-of-pocket maximum for insurance plans to $5,000 per year. Right now, the high out-of-pocket maximum that's allowed in under the ACA is roughly a third of average household income. So that's not protecting anyone, because if you're meeting that out-of-pocket maximum, you're likely in medical debt, potentially filing for bankruptcy because of your medical bills. So we really need to lower that maximum out of pocket, and that will reduce healthcare costs as well. The third policy that we focus on, which is part of the Democratic Party platform, is expanding the $35 out-of-pocket cap on costs for insulin, again, to everyone. We're not just talking about private insurance plans. It really needs to be expanded to everyone. This is similar to the Florida bill that you all are working on with a $25 cap. And it's another one of those prime examples of something that we can do on the way to Medicare for all. Now, these policies kind of have a dual purpose. Of course, they're lowering costs, but It's important to write them in a way so that insurance companies and pharmaceutical companies are footing the bill, right? We don't want to expand the cap on prescription spending and have the government pick up the difference, because then essentially the government is subsidizing big insurance and big pharma rather than actually making big insurance pay for the care that they are supposed to be giving us. And so again, there's a way to look at these policies to make sure that insurance companies are actually having to pay for them, because that's not only going to lower costs, it's going to weaken those insurance companies because now they can't just suck up all the profits that they can and not pay out any money for care. So it's kind of on a track to Medicare for all, and it's almost a way of thinking of, these are the policies that the presidential ticket is supporting right now. How can we make them the best, strongest policies possible? So then, if we go back to the platforms, I next wanted to focus on Medicare and specifically Medicare privatization, which is a big part of the Republican platform. It has been for years. And again, Project 2025 aims to privatize Medicare by making private plans called Medicare Advantage the default enrollment option. And as you may know, the open enrollment period for Medicare just started on October 15th. So yesterday goes till December 7th. So I really wanted to touch on this because if we allow Medicare to be completely privatized, Medicare for all gets incredibly difficult to get to because we don't have that foundation to build upon. Currently, traditional Medicare is not perfect, but it's a foundation for us to build Medicare for all upon, and we cannot let it be dismantled. So, looking at Medicare privatization and what those policies mean, private Medicare plans, like I mentioned, known as Medicare Advantage, are slowly overtaking the Medicare program. Now, big insurance companies, think Humana, Aetna, Cigna, United, they game this system in order to get $140 billion in overpayments each year. Very quickly, how they do that is they add medical codes to a patient's chart to make them look sicker because they get paid more money from the government for sicker patients. In theory, if profits are taken out of this, it makes sense because it costs more to take care of a sicker patient. However, since profits are in the mix, these companies will make their patients look like the sickest person ever so that they can get a bunch of money and keep it in their pockets. Now, even worse, these insurance corporations are also um, running Medicare Advantage plans that raise out-of-pocket costs for people on those plans. They do that by denying care using either prior authorization, step therapy, limited networks. Those three things are not allowed in traditional Medicare. So on top of getting in these overpayments, they're actually not paying out that much money in medical care for people because they use these bureaucratic obstacles to avoid paying for care. So the top policy priorities to fix this. So not allow the Republicans to fully privatize the system, but we also can't let the status quo go on because over time it will become more privatized. So the top things that we can do are stop overpayments to Medicare Advantage insurers by removing the methods they use to game the system. Exactly how you do that gets super technical. I'm not going to get into it now, but if you want to hear about it or read about it, shoot me an email and we can chat. Another key policy priority is adding a cap on out-of-pocket expenses to traditional Medicare. Now, Medicare Advantage plans have a cap on out-of-pocket expenses. It's pretty high. The average is around $8,000, but it's still there so people know if they have a catastrophic injury, if they are diagnosed with cancer or something like that, they have a cap where their costs will stop. Whereas in traditional Medicare, there is no cap. And so often people, especially low income people and people of color, get cornered into Medicare Advantage plans because up front they look more affordable because they have this cap. And so if we added an out-of-pocket cap in traditional Medicare, not only will it lower costs for people, especially people when they get sick and really need their health care, it would also allow people to choose to go back to traditional Medicare and stop the power and the growth that Medicare Advantage has. So all of this is to say there are some key policies that we as Medicare for All advocates can advocate for in the near term in parallel to working towards Medicare for All. We still need to be building the support for Medicare for All, educating people about it, but we can advocate for these policies and also make sure that we're at the table when they're being written so that things like making sure insurance foots the bill, making sure everyone is included and it's not just people with private insurance, because as we heard Dr. Sriram talk about, people with private insurance are disproportionately white and wealthy, whereas people of color are the people who will be left out of these policies if it's only for people with private insurance. So I really want to emphasize that while we work towards Medicare for All, let's be at the table for these policies to make them as strong as possible so that we can lower costs, but also make insurance companies weaker because, frankly, healthcare should not be an investment opportunity. And if we make big insurance actually pay for the care they're supposed to, Wall Street investors are going to notice and they're not going to be able to get their giant profits out of health insurance companies. So with that, I'll stop and look forward to any questions you might have.